Oh shit.
Smear tests.
We all have to do them. They're very fucking important, but they're so terrifying.
Yeah, we all get the letter when we're 25. Well, actually, they send it to you just before you turn 25.
They're like, oh, we know, it's coming.
Time for your smear test. I feel like no one really talks about your smear test, so you never really realise how important it is.
The only person I ever heard it from was me mum.
Same.
And some parents don't talk about it with their children, so we are your parents.
And we're telling you to go get your smear test.
Yes, it's not to be frightened. That is the main point we want to put across. It's always really daunting because the unknown is fucking scary.
Yeah.
And the fact you have to go to a goddamn hospital, doctor's surgery or clinic and spread open your legs and have someone do something in there is terrifying.
Yeah, but you should be used to it because you all go to the sexual health clinic, right, guys?
Yeah, right. You should know that feeling. It's not scary. It's not painful. It doesn't destroy you. It's absolutely, it's easy.
It's so easy and so normal, and it's something that we have to do to take care of our health. And what's the most important thing? Our health. We don't want to die.
So what does a smear test do?
The smear test is when they take some of your cells and they test whether your cells are abnormal or not. Ultimately, it's testing for cervical cancer.
Yes.
So that's megally important to test for because it's really common in women. And
it goes undetected.
Exactly. There are no symptoms, usually, like at early stages. And by doing the smear test, you are able to find out early whether the cells might turn into cancerous cells. And even if you have abnormal cells, it doesn't mean that they're going to turn into cancer. It means that they might turn into cancer. But they like to get rid of them anyway because they don't want to risk it for you.
They just want to make sure. And at the moment, lots of us are having sex at very early ages and it's getting younger and younger, which makes us more susceptible to cervical cancer.
Lots of women are affected by cervical cancer.
What do they do in a smear test?
Quite recently, I went to get my smear test, and what happened is I just went into my doctor's. They tell you to lie down on the little table, open your legs.
So they use a speculum, which is, it can be metal. Did you have a plastic?
Yeah, I had a plastic one.
Cool, man. I've only ever had metal speculums, and they can be a little bit uncomfortable because they're
cold.
Cold, and they basically it's basically like a reverse clamp that opens out your vagina so they can see into it and take a swab.
It does feel like a tiny bit uncomfortable.
Yeah,
Do you find it a little bit uncomfortable?
It's not painful. It's just uncomfortable.
Yeah, it's not unbearable at all. It's just like someone. I don't know.
It feels like a medical dick inside you that's just there.
Yeah, so it's a bit awkward because you're like...
You can see deep into my cervix, okay. But they're all trained and they're female as well.
So they just take a little swab out of your cells, which just feels like a sort of tiny little scratch inside.
Yeah, like a little inside scratch.
It's a little bit uncomfortable again, but not painful.
And it's completely normal to have weird discharge or to bleed afterwards. Again, not painful, but you will feel a little scratch. It's not like they're doing nothing in there, but they have to make sure they get enough cells for it to be sent off to laboratory.
Yeah, and then so 2 weeks later, you should get your test results back. You got your test results back, didn't you?
Yeah, my first lot of test results worried me a bit because they said that there weren't enough cells to do the test, and obviously I didn't really know what that meant, so I was thinking, oh my god, I've got no cells in my body. But no, that just mean that they couldn't get enough cells, and I had to do the test again, and it all came back fine. There were no issues with that whatsoever. But you had one recently as well. Yeah,
mine was a little bit of a different story, and it was sort of elongated because my results got sent to my old address. So I had to phone up the doctors, and they were like, and so I was like, oh, I didn't get my results. They were like, oh yeah, you've been referred to the hospital, and I was like,
excuse me? What? I'm dying. I am dying. It's the worst thing.
And so I didn't know what my actual results were until I got to Colonoscopy. I think it's Colonoscopy appointment, which is where they look inside you again, but this time they have like a little camera and like little thing where they look up inside.
Oscopy's a camera because you can get like a throat. I can't even remember what they call it. Colonoscopy's up your bumhole.
Yeah, so it's similar but up your vagina. But what happened is I got there and I was like, so I didn't actually get my test results back, so what are they? And he told me that I had moderate abnormal cells, which means that they're probably not gonna go back to normal cells. If they're minor, then sometimes, like, they quite often just turn back to regular cells. But when they're moderate or severe, they're probably gonna turn into cancer at some point. So they like to remove them. He looked inside and he took a biopsy from me, which was a little bit uncomfortable.
What's a biopsy?
So a biopsy is when they take a little bit of you and send it off for taste testing.
Like a mini bit of Florence.
Yeah,
flying off.
A little bit of my cervix, actually. And so what happened is they squirt this vinegar solution inside your vagina, and that makes the abnormal...
Sounds so horrible, like
yeah,
vinegar.
A little bit. It did feel a bit weird. It was like a little bit stingy, to be honest.
Oh, yeah, was that before or after the biopsy?
This is before. So they do that vinegar solution, and then the abnormal cells show up as white. And that's so they can know where to take the biopsy from and see how big the area is. He said that my area was quite small, but I didn't see it. Some people see what's on the camera, but he didn't show me. And then they get... I don't really know what they use to get the bit of you, but basically they tell you to cough when they pull it out.
Yeah,
so
you always get the coughing.
they sort of, I guess, it's a little hole punchy kind of weird device.
Oh yeah, you know what? When I had a colonoscopy, I had the same thing. They found a polyp, which is like a similar thing, potentially cancerous, and it's like a little, almost like an eye of a needle, a giant eye of a not giant because it's going inside you, a small eye of a needle that has like a little snipper on it.
Yeah, so that's what
and
it
they
was.
just like pinch it and they take a bit. Yeah.
And then after that, they apply a solution which is supposed to help your skin like heal inside. I had a bit of an annoying experience because he was like, "Oh, this is really stubborn." And I was like, "Great."
Why would you tell me that, asshole?
So I'm bleeding, and then you have loads of weird discharge afterwards. So they give you a pad to wear.
How long did you bleed for?
About 6 days.
Yeah. Okay, so it's like a period.
Not really. It's like this weird brown liquid. It's supposed to be brown. Like, it shouldn't be red. If it's pure red, then you should call your doctor back up because it's obviously not healing properly. But it's like a brown liquid, so it's like old blood. Yeah. And also you get weird discharge from the solution that they put on to stop it, and the vinegar. So you have all these like shedding. So I'm painting a really gross picture of this, but basically your cells shed out, and a solution comes off eventually, so you get like weird discharge in your knickers that looks a bit like grey, like fish scales.
Yeah, you're like, what is this coming out of me? And that can be a bit like nerve-wracking.
It was a bit scary when because I was like, there was so much of it that came out once. It was like having a little mini poo from your vagina. And I was like, what just fell out of me?
Like, is that all of me?
Yeah.
Oh,
so I looked it up. And you know what's been really helpful for me, because I'm still waiting for my results. I haven't got my results back. But I've been looking at Joe's Cervical Cancer Trust website, and they have answers about everything that you could possibly want to know about your results. I feel like completely annoyed at myself for not getting tested sooner, because I've ended up getting tested halfway into being 25 instead of before I even got to 25 when I had the letter. My moral of the story is go get tested as soon as possible, because you never know what's happening, and I still don't know what's happening inside me. It's a bit scary, it's daunting, and it's okay to feel worried. It's completely normal to be worried. I know a few girls that this has happened to, and they did go through like quite awful, anxious periods of time because you're waiting on these results, and it's really nerve-wracking. But hopefully, like, there's another procedure that I'm gonna have to go into next, which is where they sort of burn out a little bit of your cervix, but then it gets rid of the abnormal cells, and it hopefully you won't get them again, but then you get tested more regularly.
Because the problem is, if you don't get tested, you don't find out you have it, they can't do anything about it.
Exactly.
Before it's, possibly too late. And that is the major issue with cancer, is that it's almost symptomless.
Well, that's the thing as well. Like, I had absolutely no idea that I had abnormal cells down there. Like, there are no symptoms for it, like, at this early stage. So the only thing that you can do is go and get your smear test.
Yeah.
I can't, like, tell you enough, really, to go and get it, because, like, you just need to get the right treatment.
Because
It's so important.
There's been issues, you know, in the media where girls have wanted to get them at a younger age and they haven't necessarily been allowed, or not been allowed, but not taken seriously enough. So if you are younger than 25 and you are worried, you can still go to your doctor and ask for a smear test, especially if it's causing you anxiety. When you are 25, if you haven't received that letter yet, which you have, go and ask for a smear test.
Yes.
Get one done, just for peace of mind. And are you glad that you've had your smear test now?
Definitely. I mean, obviously it's caused a bit more of a problem for me, but like it's good that it's happening. It's good that they found the abnormal cells and that I will be able to be treated.
You can you can sort it out sooner rather than later.
Exactly.
Yeah.
Like if I hadn't got my smear test, like who knows what would have happened.
Exactly.
Which is scary. I don't want to scare you girls, but you do need to go get it.
Yeah.
But like also don't, like, not everyone gets it. I'm just like one of the people that it happens to, but it is quite common as well. So don't be scared. It happens to a lot of us. It does cause a lot of worry because it's the word cancer.
Yeah, that's a scary word. And it's our vaginas, they're inside us.
Yeah.
And, you know, we don't feel an awful lot of pain inside us except when we have a period.
Yeah.
So it's like, it can just feel really, really nerve-wracking. You think, what's going on down there?
The only thing that I would really say is that after the biopsy as well, it's completely normal to feel like a little bit of cramping pain. Because it is a really like awkward procedure, having someone like looking inside you. I felt a bit emotional afterwards, and I've heard that from a lot of people that have had it. I don't know why that happens, but
That's
I guess
so
you feel
interesting.
quite like invaded your space, because I was like, well, I had like a man looking up inside me as well, which I felt like a tiny bit more uncomfortable with, because I don't know, it's my vagina and he doesn't have a vagina.
Doesn't relate. But if you're worried about that, you can always request for a
you
female
can.
doctor. I guess you just didn't know at the time.
Yeah, I didn't know.
But I cried all the way through my colonoscopy.
Yeah.
I was like, why? But I was also drugged up to high heavens. But yeah, thank you very much for sharing with that with us, Florence. And yeah, let us know if you've been through anything similar. If you've had a smear test, how was it? Let us know. We enjoy all your comments, and it helps other people to learn too about other opinions.
Yeah, and let me know if you are going through the same thing and we can get through it together.
Yeah, guys, thank you so much for listening.
Definitely comment on this video if you have anything to add, and like it if it's been useful for you.
And get your smear test.
Get your smear test. Do it. And we'll see you next week.
See you next week.
Bye.